All right. Hello, everyone. Happy Friday and welcome to our most recent info session. We've been trying to do a couple of these on important topics throughout the year. And today, this week, is Frontotemporal Degeneration, or FTD, Awareness Week. This is a week that is nationally recognized, but for the first time ever, the state of New York has recognized FTD Awareness Week through a resolution that we put forward because we believe it's incredibly important for more people to understand this disease, frontotemporal degeneration. I myself have had a very close experience with it. My father passed away in 2017 from FTD. And FTD is an often misdiagnosed disease, something that many people don't even know about, including in our medical community. A lot of doctors and people usually think when someone is diagnosed with FTD, they've been misdiagnosed many times before. They may think it's a type of Alzheimer's or some other type of behavioral disorder, but it's not. And it's something that we need to learn more about, and we need to bring more attention to within our community, so that everybody who does end up having frontotemporal degeneration and the many strains in which that covers really gets the support and the help they need and the understanding that they'll need to be able to kind of get through and to help a loved one get through that experience. For us and for my family, my mom became my father's primary caregiver. It's something that requires extensive long-term care many times. And, when you're in that situation, you look for support, you look for help, and you want people to be around you who know this experience. And the Association of Frontotemporal Degeneration, or AFTD, was really a lifeline for us. It brought us connected to other people who are experiencing this, other families, other caregivers. We were able to hear firsthand stories from people themselves who were diagnosed with FTD. And the incredible staff at the association was always there, wanting to make sure, that we were armed with the tools and the information that we needed to be able to get through, and also to be loved ones, right? To care for my father, and not just have to shift to caregiving. And so I am so happy to be here with Matt Sharp, who is the advocacy manager for the AFTD. He's going to give us some information on the disease itself. And, when we announced we were doing this, again, it's a little known disease, but something that impacts and affects a lot of people globally, but especially here across the country. And people have come out really of the woodwork saying, my family has an experience with FTD. Thank you for doing this, because we are in our own pockets. Because so few people know someone else going through this same challenge. And so part of the Awareness Week, recognizing it for the first time in the state legislature here in New York, is purposefully to bring people together. It's to bring all of us together. So if you know someone, if you yourself or you know someone who is living with or struggling with or supporting someone with FTD, reach out. We can connect you to the resources. And if you just are here to learn more about it, thank you, because that's what we need to do. We need to spread this message. We need more people to recognize what FTD is. And before we get into the presentation with Matt, I want to remind everyone to drop their comments or questions in the chat. We're here. We're going to have a little bit of a question and answer at the end. So if you have questions already, put them in the chat. If you have questions while Matt is explaining anything, put them in the chat too, and we'll be monitoring those and getting to them at the end of the presentation. So Matt, thank you so much for your work in the FTD space. Thank you to the association for everything you all do. And I'm going to turn it over to you to give us some information.
Great. Thank you so much, Senator Hinchey, and thank you for all the work you're doing to raise awareness. You're absolutely right. The more people know about this disease, the better, because turning to each other is really the first step in trying to get help. My name is Matt Sharp. I'm the advocacy manager for the Association for Frontotemporal Degeneration, and I've been with the organization for about 10 years now. So next slide. Sorry. All right, here we go. So I'll sort of back up a little bit to start with and talk a little bit about what dementia is to begin with. Dementia is not actually a disease in and of itself. It's a global term that reflects changes in thinking, behavior, and emotions. It's a term used to describe a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. And that is an important caveat, is that it does make it difficult to do the things we all do on the day-to-day. It isn't a specific disease, like I said, but there are numerous diseases that can cause dementia. Dementia itself is caused by damage to or loss of nerve cells in the brain and their connections. So depending on the area of the brain that's damaged or where the loss of cells is happening, that's what's going to determine what the symptoms are. And the different parts of the brain control different behaviors and abilities. So there are, like I said, many medical conditions that can cause dementia, and some of them are, in fact, reversible. So one of the first steps most neurologists will do is to try and determine whether or not whatever is causing the dementia can be reversed or stopped. And this is a nice quote that kind of sums up dementia very, very succinctly. So it's a condition of the mind caused by a disease of the brain. So dementia itself is an umbrella. It's used to describe a range of progressive neurodegenerative diseases. The four most common forms of dementia are, of course, Alzheimer's disease, which most people are familiar with, vascular dementia, which is related to stroke, and dementia with Lewy bodies, which is related to Parkinson's disease, and frontotemporal degeneration. The signs and symptoms and causes of age of onset and prognosis differ based on which of these diseases is causing the dementia. Frontotemporal dementia, or FTD, is the most common form for people under 60. It can be devastating for people who are diagnosed with it and their families because of that younger age of onset. People who are affected are often at the height of a career or actively raising older children. So it can really disrupt people at a prime of their lives. So how is FTD different from other types of dementia? First of all, it is primarily a behavior, language, or motor disorder, and memory is not the primary symptoms, and often it's not affected at all. And by memory, I mean long-term biological memory, remembering who you are, who your children are, what year it is, things like that, not necessarily that temporary memory loss that can happen in FTD. Onset of symptoms in FTD ranges widely. The youngest documented cases of FTD have occurred in people as young as 21, but it's also started in people who are in their 80th year. So there's a huge variation in terms of when the disease can start. However, the majority of cases do occur in individuals between 45 and 64 years old. And the average age of diagnosis is 57. So that younger age means people, are more physically active compared to, say, an Alzheimer's person who is typically in their 70s or 80s. So the people with FTD do tend to be more physically active and have fewer comorbidity or other health issues going on. And like I said, they're often deeply engaged in work and family life. Our best guess is that there are around 50 to 60,000 people in the US who have FTD, but that is often thought of as an underestimate. One of the big challenges with FTD is that it's very hard to diagnose. And like Senator Hinchey said, it's often misdiagnosed. So until there are better diagnostic tools available and widely available, it's going to probably be underestimated. And there is a lot of progress being made in developing new diagnostic tools for all forms of neurodegenerative diseases. And in fact, there's currently a blood test in development for Alzheimer's. And it's something that could be, given in a doctor's office, like we all have blood tests every now and again. That would be the best, sort of the golden holy grail for diagnostics. But until those tools are available, people are really going to still have to sort of guess at the actual numbers out there. A few years ago, the association did a study on the costs of FTD, and we got responses to a survey from nearly 700 care partners for people living with FTD. The study was published in the Journal of Neurology in 2017, and it concluded that the average annual costs associated with FTD are roughly double those of Alzheimer's disease. 12 months, another result of the study found that 12 months prior to diagnosis, overall household incomes ranged from $75,000 to $99,000. And then 12 months after diagnosis, income declined to $50,000 to $59,000. So that gives you a good sense of just how much impact it can have on families. Alzheimer's disease costs are estimated to be around $64,000. And costs associated with FTD are estimated to be almost double that, around $120,000 a year. And again, much of that difference in the impact it has to do with age. And it was found that often FTD caregivers, so they had to stop working once a family member was diagnosed. And also there's a disproportionate impact in terms of financial decisions that people with FTD make, often prior to diagnosis. Since one of the symptoms is impulsivity and poor decision-making, people will occasionally spend a life savings within a week or so and have devastating impacts on people's finances and futures that way. Now to sort of give you a general overview of the biology of the disease, like I said, the symptoms of FTD really are dependent on the parts of the brain that are affected. Frontotemporal refers to the frontal and temporal lobes of the brain. So that's the area in blue here and the area in green. And that's where the degeneration occurs. So that's where the loss of nerve cells is happening. And there, when it happens in the frontal lobes, you see that the most common symptoms are listed. Like I said, executive functioning, problem solving, emotional control. All those things are common symptoms in what's referred to as behavioral variant FTD. The temporal lobes are deeply involved with language and communication. So oftentimes that's when you'll see language disorders that are associated with FTD. So people have trouble speaking, making sentences that make sense, understanding words, and a whole range of those sort of verbal and language and communication problems. Underlying the loss or the atrophy of neurons in the brain, there are specific proteins that are involved. And in FTD, the most common proteins are called tau and TDP43. And this is different than, again, Alzheimer's, where the most common protein involved in Alzheimer's is called beta amyloid. So one of the ways that they are able to diagnose FTD definitively is by looking in the brain, unfortunately, at autopsy, and being able to identify which of the proteins were involved or associated with the atrophy in the brain. And currently, that's the only way still to diagnose FTD with 100% accuracy. Like I said, there are other ways being developed for Alzheimer's disease. So it is possible at least to rule out Alzheimer's disease in some cases, But in FTD, they can't tell what proteins are involved until they're able to autopsy the brain. And again, that's one of the main differences between FTD and Alzheimer's, especially from sort of a research medical perspective, is those different proteins. So like I said, FTD is difficult to diagnose. We hear from families that finding diagnosis is a very frustrating process. And families often have to advocate and push doctors to do more testing in order to find answers. The changes that are seen in FTD mimic dozens of other diseases and conditions. So to date, 50% of patients that are diagnosed with behavioral variant FTD will receive a prior psychiatric diagnosis. Something like bipolar or often schizophrenia will be one of the first diagnoses made, in part because most doctors just have never seen FTD before. And on average, families face a delay in diagnostics that is up to 3.5 years from the time the symptoms occur. And again, considering the symptoms and how disruptive they can be, that's a long 3.5 years for sure. And often before a diagnosis is made, a lot of harm has already been done by impulsive decisions and a variety of other consequences. Like I said, it's usually the first step is some sort of psychiatric disorder. And most physicians, especially primary care physicians, have not had specific training in FTD. And they're not suspecting dementia in somebody in their 50s, which is, again, just unusual aspect of FTD. So while the symptoms can change over time as the disease continues to progress, the first several years of FTD can be really confusing and chaotic. So often family input is really critical to making an accurate diagnosis of FTD. One of the key and critical factors is that FTD causes a change in behavior and abilities. And without family input, most doctors aren't going to be able to appreciate what someone was like prior to the time they came into their office. So family input is really critical, and it can be hard for families to give that input and to have doctors listen to them. So what we call FTD, or frontotemporal degeneration, really is a complex of disorders. There are, like I've mentioned, specific behavior or personality changes that occur. And when those are the primary symptoms, the diagnosis is behavioral variant frontotemporal dementia. Sometimes this is even called Pick's disease, which is the term actually that was originally given to these diseases a long time ago. But now we usually refer to it as frontotemporal dementia or behavioral variant FTD. When there are language changes, the diagnosis is often primary progressive aphasia, or PPA. And there's 3 different types of PPA that relate to specific language problems that are involved with PPA. And then there are motor function and movement changes that occur. Like I said, this can be similar to Parkinson's disease, and there are specific syndromes that are used when there are those types of motor symptoms. But there's also an overlap between FTD and ALS, or Lou Gehrig's disease. So you can see there's a range of different types of physical and movement changes that can happen with FTD, and often in association with the other changes. So it's not as if everybody will fit into one of these 3 categories cleanly, and there's a lot of overlap between them. So what FTD tries to do is really, provide people access to research. We try to raise awareness, provide support, or direct people to supports specifically for frontotemporal dementia. And we do a lot of education. either directly or just by providing the information for people to use themselves so they can go out and educate oftentimes their doctors or other providers. And we advocate, for research and appropriate and affordable services. There's a lot of research currently being done in dementia right now. A lot of it's focused on Alzheimer's, but there is a significant effort on the part of the federal government and specifically the National Institute of Health to develop cures and prevention for FTD. Our overall mission is to improve the quality of life for people affected by FTD and drive research to a cure. So our helpline is one of our first lines of service. It's often the first way people contact us. It's both a email address and telephone number that people can use to reach out with just about any conceivable question you can think of related to FTD. Our website is listed there. We also developed a website specifically for kids and teens with a parent with FTD. We have a few different publications and newsletters, and you can register for those through our website and our homepage. There's also electronic versions available that you can just read online. We have a special publication called Partners in FTD Care, which is intended for healthcare professionals, and it will examine a symptom or aspect of FTD in some detail and depth. So it looks at sort of one piece at a time and is often full of really good ideas and tips that professionals can use, but also people caring for a loved one at home. And again, you can register for those online. We also have a small financial grant program. We offer respite grants and quality of life grants. Our respite grants go directly mainly to care partners and can be used really for anything that supports that person's quality of life and well-being. And our quality of life grant is unique in that it's given directly to the person with FTD. And again, it can be used for any service or product that promotes wellness and well-being for the person diagnosed. We also network a large number of support groups across the country. These were originally in-person groups. A lot of them moved online once the pandemic started. Many of them are now transitioning back to in-person or still being run remotely online. So, if you have any questions about a support group in New York State, please just don't hesitate to give us a call or email us at our helpline. We do list all the support groups on our website as well, and you can find them there at that link. And that's sort of the broad view of FTD. And I hope people may have some questions. And of course, like I said, you're always welcome to reach out to us through our helpline with any questions that may occur to you later on after this presentation, if they don't occur now. So, really it is critical that people with facing this disease reach out and contact us or other people, because that support from peers is really the first way people find help and get connected. So thank you very much. And with that, we will hopefully take some questions.
Yes, thank you, Matt, so much for that presentation. It was a lot of really great information. And, for me and our family's experience, my father had PPA, suffered from primary progressive aphasia. And just to give a little clarity on kind of what that can manifest as and how it started, to be on the lookout, one of my father's favorite things to do was go to dinner, supporting small businesses in our community. And, we'd be having dinner and it could be anything from pass the spoon instead of pass the salt, right? 2 S words on the table, same area, right? But having the brain have a challenge of finding the right word, knowing that it was an S word, something on the table to do with a meal, but not being able to recall the right one. And, with the progression, this was the language variant. with the progression, that changed to knowing exactly where moving forward, the restaurant we wanted to go to for dinner was, but having to point in a direction because you couldn't remember the name of the restaurant, right? So you kind of see over the years into, I saw someone mention in the comments that their loved one is nonverbal. That kind of is, especially with the primary progressive aphasia variant, with the language variant, that is the end, right? Kind of the end game for that. People lose the language and they're unable to recall it, and it becomes a very lonely disease too. So that's why these support services and these peer groups are so important, because it can be incredibly draining on you, the caregiver, the family member, to watch your loved one be in such a lonely state while you're there, right? And so being able to find strength in others and to find things that may work, different kinds of books, different kinds of things like that may light up different parts of the brain that are still able to function. Music was a big thing that was helpful for us as a tool for anybody to use, while verbal language was hard to recall. When you would put on a song or you would put on music, especially for us, it was Elvis, early favorites. My father would be able to sing. Maybe not the entire song, but he'd be able to sing along with the chorus, right? So because music language is held in a different part of your brain. So there are definitely tools that the AFTD can help you with that will be able to connect you further with your loved one who's suffering. So Matt, thank you so much for this information. And we do have a bunch of questions, which is great. And, I know that many of you in this chat have a direct correlation to FTD. And so thanks for tuning in. And to reiterate, I know it was mentioned in the chat too. Yes, this Zoom will be saved. It will live on our Facebook page. We will also have it on our website that was just dropped into the chat, as well as the links that Matt has shared. So that information will stay on the screen. We'll also make sure to drop those links in the chat too, so they're easy for everyone to access. So we will start. There's a couple here. Also, I saw someone mentioning hospice. One interesting thing that's really helpful that we learned later on, but hospice has people think of hospice as very, very end of life care, right? At the very end of your days, that's who you turn to. If your loved one is diagnosed terminal and there is not a cure, hospice can help you. And they were a godsend to us as well. They helped. They had visiting nurses. They had people check in. They had the 24-hour hotlines. They were places that we could turn. And so when someone is diagnosed with FTD, contacting hospice early is a really good idea. And Matt, if you have anything to add to this, but we believe that hospice is a really good idea because that is a host of medical resources you will be able to utilize. And again, a lot of people think it's towards the end of life. If you are diagnosed and the end of life is coming, hospice can help you.
Yeah, absolutely. And hospice provides a type of care called palliative care. Hospice is a specific type of benefit or service that has to do with end-of-life care, but palliative care can be delivered at any time, and it really is focused on keeping people comfortable and maintaining quality of life. And AFTD actually just did a webinar all about palliative care that's on our website right now. And like the senator said, getting in touch with hospice agencies sooner rather than later is key. Because the services, the care they provide, it doesn't have to be just at the end of life, and it can benefit people much earlier on. And often hospice agencies will be able to connect people with other palliative care services that can be started earlier. So yeah, palliative care and hospice are such a critical resource that is often not used until it's too late.
Thank you. We have a couple questions too about genetics. Is FTD, and again, this is something that why we want to call attention to, because we need a lot more research in this space. But from what we know now, do we know if there's a genetic component? And also, you had mentioned kind of earlier possible tests specifically around Alzheimer's, but is there anything being developed for FTD in that space? And also, do you know if FTD has direct, I'm reading it here, association between pre-existing mental illness and damage from ECT therapy? So genetics and other types of causes.
Okay, thank you. Yeah, and genetics is a complex and evolving subject, and I'd really encourage people to visit AFTD's website. We just added like maybe 3 or 5 new pages all about the genetics of FTD and how to find genetic testing. So unlike Alzheimer's, there are a higher frequency of genetic cases of FTD. And in some estimates, about 40% of all FTD cases have some genetic basis. And we know there are families that carry FTD genes. So FTD, the genetics of FTD is, again, it's complicated. There are multiple genes involved, and trying to figure out which ones may be involved in an individual family does require genetic testing that's available in a variety of ways, often through a research project. But again, there's a lot of information about that right now on our website, in part because the genetics of FTD is an important aspect of research. And once a gene is identified, people are able to participate in specific research projects that are related to specific genes. So it is far more frequently genetic in FTD than in other forms of dementia like Alzheimer's. But still, the majority, around 60% of cases of FTD are called sporadic. So that kind of means essentially that we don't know what the genetic influence is really. There's usually not a family history in sporadic cases. So it's harder to tease out what the genetic piece is. And the real complexity comes in from trying to figure out how a person's genetics are interacting with environment, which kind of gets to the second question. Things like ECT certainly can cause damage and to the brain, especially ECT as it was delivered long ago, decades ago, really could be damaging. And there is a connection between that sort of damage to the brain and subsequent FTD, but it's not a real clear connection. And so it's not possible to say, one leads to the other all the time.
Thank you. Another question that we have in the chat is, what is being done to improve doctor and counselor awareness to increase time for this diagnosis?
So AFTD just recently hired an education manager, and it's going to be one of our priorities. As our staff has increased, we've been able to do more and more of the things we really want to do, like provide training for doctors and other healthcare professionals. Often doctors are a harder to reach audience, but getting to nurses, other people on the front line about what FTD is and how it's different is a real priority for AFTD. And we've started at least one education initiative to try and reach out to healthcare professionals and provide them with basic information about FTD and how it's different than other forms of dementia.
Thank you. And we touched on this as kind of the other cause question. And again, these may not be some of the best answers because we are still figuring this out. And it's groups like AFTD, a small but mighty and growing group that are really on the front lines of pushing people for more research and fundraising to do more research as well. But if it's not genetic, do we know what causes the other large percentage of FTD? And if not, what do you think we need to do and the medical community needs to do to get there?
And the short answer is we just don't know what the causes are. We know it's some complex interaction between genetics and environment probably. And so different aspects of people's environment may increase or lower risk. But there's just so much more to study on that question, especially in a disease like FTD that's so rare and hard to diagnose. So really one of the things that research is focused on in FTD is called biomarkers. So things in a body that are going to help be able to definitively diagnose FTD and the underlying causes of FTD. specifically those proteins. So until we have those tools available, it's going to be just almost impossible to associate environmental factors with the genetic pieces. So we sort of have, we don't have both pieces of that puzzle yet. So finding those biomarkers is really key, because in addition to diagnostics, the biomarkers are used to help measure effects of clinical trials and experimental medications to see exactly whether or not it's effective or not. So biomarkers are like a real linchpin within the world of FTD research for so many reasons. And one of those reasons is to try and understand what risk factors are out there, and how people can modify behavior. Diet's probably a big factor. Lifestyle's a big factor. We know there are things people can do to diminish risk of dementia in general, but how that all specifically relates to FTD is just really a big unknown at this point.
Yeah. And we'll say from our experience, this was never fully tied, but my father had something called sudden hearing loss earlier in his life, and could have been caused by a stroke. That itself is also another thing that people don't know really what causes it. And I read one study that I was able to find that linked the two, but again, these are two things that not a lot of people know much about. So it's one of the reasons why we wanted to hold this information session, so that we can not just start to raise awareness, but really start the conversation from the state level too. How do we work to invest in this? How do we bring people together, build the sense of community, but have more people talking about it and recognizing it and advocating for it, so that we can actually get the funding and the research that we need, and that we can then stand together really and give our loved ones the support and the help that they need. Another question that we have from the chat. I thank you everyone for putting in, for being so active and for putting comments and questions in the chat. Is this countrywide, AFTD? What is your coverage region? How do people find you, and how are other states approaching this? And how can we get them? We're providing two questions. How can we get other states, like we have now done here in New York for the first time ever, to recognize FTD Awareness Week, so we can really start to raise the profile nationally?
And yes, AFTD is a national organization. We don't have chapters like some other nonprofits, but we're working to develop a network of support groups and volunteers working to accomplish our mission. And things like FTD Awareness Week is a great opportunity to bring people together and hold events like this info session, but also just community and family events. A lot of this awareness kind of starts by right at home, and making sure the rest of families understand what this disease is and why it's different. And more we're creating this network to help facilitate these events and help get the word out about this disease and why it's different than other types of dementia.
Right. And speaking of that dovetails well into our next question. Are there other subgroups of dementia?
Yes. As I mentioned, one of the more prevalent forms of dementia is called Lewy body dementia. And that has its own association as well. There's historically sort of been a divide between movement disorders and behavioral disorders, but we're learning more and more that isn't really true. So even things like Lou Gehrig's disease usually involves cognitive changes as well. Same with Parkinson's disease. So even while there are different names and sort of subgroups here, there's so much overlap in all the symptoms as well. So it is possible to think of dementia as this overarching general term with lots of different, differences and subtypes underneath it. And again, Alzheimer's disease is the most familiar, but it's far from the only form of dementia.
Thank you, Matt. And we're getting a little close to time here, but I want to make sure we get to as many questions as possible. We've had a couple questions about including a loved one who is suffering with FTD in care decisions. in, how do you decide as a family that you can no longer keep them at home based on costs or just home care workers. It's something that we talk a lot about. I think there's some people on this call who've heard me talk a lot about the need for fair pay for home care. If you are able to or want to keep your loved one at home, we need the resources, we need the people to help. But as you're having those conversations with your doctor, your loved one's doctor, and other support groups or, care facilities, figuring out what those next steps look like. Should the loved one, what do you all kind of recommend? Should the loved one be a part of that? At what level should you be doing that on behalf of your loved one? And what should that partnership look like?
I think in FTD, but in all disorders and diseases, advanced planning is key. FTD can really sneak up on people and sometimes force them to confront some of these decisions much sooner than they were expecting to. But there are a variety of ways that you can have your wishes for the future written down so that when you're no longer able to speak for yourself, you can make sure that you have those wishes and plans followed. So advanced planning is really key. Advanced directives, living wills, things like that. There's not a lot of harm in doing them, and you hope you never need them, but they can be so helpful if you do need them. So that's certainly one thing. And too often, once people are given a dementia diagnosis, they're sort of written off as no longer fully human. And that's just not the case, especially early on. So it's simply, having these conversations, asking the questions. You may have to find, sometimes it's hard to get at exactly what people with dementia want, what their desires are, but simply remembering that, they are still people who have their own thoughts, experiences, and desires, and are going to try and communicate that one way or the other. So, as a family member, often you are in the position to best understand what a loved one wants, and just being as sensitive to those needs and wants as possible is key. And I mean, it gets hard. I don't want to diminish that at all. It gets really hard, especially when it comes to decisions about care at home versus residential care. Most residential care in the US is designed for people in their 70s or 80s who have memory loss. So when you have somebody in their 50s or 60s with FTD, it's like fitting a square peg in a round hole, and it's really, really challenging. So again, to the extent that you can make plans ahead of time and trying to figure out what you can do at home, what services are possible, again, reaching out to hospice earlier is often a real key, especially in the later stages of this disease, at making it possible for people to stay at home. But when people do turn to residential care, often that decision is thought of as a way of giving up and abdicating your responsibility for caring for your loved one. And it's just not true. Care partners are a key part of making residential care successful, and most residential care facilities will accept whatever help you can offer. So approaching them and the staff as partners is also key. And AFTD spend a lot of resources developing tools for people to do that. Again, Partners in FTD Care is a key publication that is meant to be able to help frontline care providers understand what FTD is and how to deliver appropriate care. So, it's a hard challenge to do this, but we have resources and tools that can help. And again, just trying to find other people with FTD to talk to, potentially people who may have faced these decisions before can also be really helpful. And we can try and help put people in contact with those peers.
Thank you. That's a great resource. And I think for our last question, We touched a little bit around this, and I know it's different, but can you talk about the progression a little bit? What does the progression look like? Recognizing everyone's probably a bit different, but what does, once you are, from when you're exhibiting those first kinds of signs, whether it's through diagnosis or just through family recognition, what does that look like, and how long can that last?
Yeah, thank you. That's a great question. The average life expectancy in FTD is between 7 and 13 years. Again, there's a lot of variability in that, and there are people who've lived for decades with a diagnosis. And in some cases, it can progress fairly rapidly. But on average, 7 to 13 years is a good number to keep in mind for planning in terms of progression. There aren't formally defined stages in FTD like there are in other forms of dementia, outside of sort of early, middle, and late, or mild, moderate, severe. So those basic three categories. When I talked about the complex disorders and how FTD is split up into different subgroups, that really refers to sort of the initial symptoms. So like you were describing, Senator Hinchey, with the language challenges your father experienced, often that area of functioning will be the first to sort of decline, and it can start subtly, but then get worse over time. People may occasionally confuse some words at the very beginning, and then start consistently confusing words, and then start losing more and more words, with the progression going to becoming nonverbal. So within the different categories of FTD, between the language disorders and the behavioral disorders, you'll see, sort of initial symptoms that grow worse, but then oftentimes the disease will sort of jump categories. So people who start with behavioral symptoms may develop language symptoms as well. So that's one way to kind of gauge progression in FTD, is when you see one of those sort of jumps into different categories. But it really is sort of a slow and steady process, and there aren't well-defined stages, unfortunately. And a lot of it does have to do with overall functioning. And one way to think of it is, how much assistance does somebody need, and how much is a care provider doing? Because as the disease progresses, people will need more and more care over time, until eventually, in the terminal stages, with FTD, people are often nonverbal and confined to bed, and not able to do even basic functions like feed themselves.
Well, thank you, Matt. Thanks for sharing all this information. I'm sure that we could all be together talking about FTD and the variants and questions around diagnosis and what to do in certain situations for a long time, because no one is having this conversation elevated. And so these forums are few and far between. And so I really want to thank you for spending the time with us this morning during FTD Awareness Week to make sure that we could get some more information out there, and for all the work that you and all of your colleagues do in this really challenging and, quite frankly, really frustrating space that we need to learn more about. And to everyone who's tuned in, who's been writing personal stories in the chat, thank you. I hear you and I see you. We've been through this too. It doesn't get easier. Because this is something, as we've now talked through, this is a progressive disease. This is something that we need more attention to. We need more funding. We need more research. So many people are diagnosed with this and who are suffering, living with misdiagnoses, living with family members who don't know how to help them because they don't know what it is that they have. And then those that actually do get the diagnosis, that are, quite frankly, the lucky ones who at least understand what it is and can understand some of the science between what's happening in the brain. Even if we don't know the why, we know the what. We need to be able to do so much more to, one, ultimately find a cure for this, but to also make people as comfortable as possible while they are living with this very challenging disease. And so for everyone who is struggling with a loved one, struggling with support, feel free to reach out. We're happy to connect you. Please contact AFTD. As I said, for us personally, they were a great resource. And if they don't have the answers, they often know people who may. So they're working in the trenches in this every day. So please reach out. Again, we'll put all the links that Matt shared in the chat so that they're easy to find. This presentation will stay here on Facebook. So please share it too. If you have, again, family or friends who are interested in learning more about this, please share this. Tell them to get in touch because we are where it starts to be able to make real change in the trajectory of this disease and dementia in general. So thank you all so much for tuning in. Let everybody know that it is FTD Awareness Week. Tell them to do their research. And thank you all. We send you our love and really appreciate, Matt, you being here with us today. Thank you.
Yes, thank you. And thank you for all your work, Senator Hinchey.